everyone. Welcome back to this concept capsule. The idea is always remains the same, decoding the high-yield MRCOG concepts in less than a minute. So today's topic, epidural anesthesia. So what is this? So this basically is a procedure where local anesthetic drugs are injected into the epidural space, thereby blocking spinal nerve roots. And the level of insertion of local anesthetic agents in this case includes L3 or L4 or L4 and L5. And what are the key effects produced by epidural anesthesia? It provides excellent pain relief in labor in the dermatomes T10 to S5. So it also allows the provision for top-up dosing in case instrumental delivery or even cesarean delivery is required. What are the various complications which can occur with this procedure? Number one is maternal hypotension, which is most common, and this occurs due to sympathetic blockade. Secondly, there can be accidental dural puncture, which can result in post-dural puncture headache. Rarely but importantly, you can also have complications like high blockade, infection or nerve injury. What you need to remember is that epidural anesthesia does not increase the risk or rate of cesarean section, but may slightly increase the rates of instrumental delivery. So you need to remember that epidural anesthesia is a gold standard for labor analgesia and is a safe and effective procedure. So that was all for this concept capsule. Here's a question for you. Thanks so much for listening, and now I shall see you with the next concept capsule. Stay tuned.